Assalamualaikum dear doctor. In this video I am discussing about infective endocarditis history. How can we take? So infective endocarditis history, the presentation is like fever in a cardiac patient. Sudden develop high grade fever in a diagnosed cardiac patient, then infective endocarditis can be developed. So similar the introductions, then we start the analyzing of the chief complaints. The onset, when it started, course, how long the patient is suffering and the duration, and is there any aggravating factor you think that aggravate these conditions, and any inhibiting factor you think that this condition inhibit these features. Then we ask the fever grades. We highly take the history of the fever, how he take the temperatures, it is higher grade, and by paracetamol taking the fever is subside or not, or any treatment he is taking or not. Then the fever is association with any rigors, fits and night sweat. We ask any other concern like any other chronic disease present or not, and dysmorphism present or not. We ask. So chronic disease, we know that cardiac patients. So is there any cardiac patient previous presence or not? We will ask. Rest of FWASL plus activity plus recent. FWASL, that we know that F for fever, W for weight loss, and activity, sleep and lump or lymph nodes. Is that this condition develop after any procedure, tattooing or piercing? Tattooing or piercing or any dental extraction or anything before this condition develop happened. Now we ask the CVS, systemic review. We go for CVS, we ask that is there any heart racing, awareness of the heartbeats, blue lips, pillows, how much pillow he takes for sleep and exercise. And intolerance, fainting or small, interrupted feed, sweating during the feeding, if breastfeed, small for age. And then CNS, we ask that any weakness, facial asymmetry, abnormal movement, gait or eye squint. Any concern about vision, hearing, speech, we will ask. From chest, we ask that any bug, pain, breathing problem. GIT, we ask the tummy size, tummy pain, throwing up, poo, oral hygiene. So poo, oral hygiene, we will ask. UTI infection can be developed, throwing up. Then urinary, we ask the pee, bugs in pee system, blood pressure, eye edema. Blood pressure is red flag, we ask it. Musculoskeletal system, we ask any skin spots, neck swelling, skin swelling or nodules, bone, musculoskeletal system, joints pain, nail spots. So these are the features of infective endocarditis. We know that skin swelling or nodules. Is there nail spots? Nail spots, some features we know that splinter, hemorrhage, ossular nodes. These are we exclude. Endocrine we ask. Then hematology ask any bleeding, bruising, pale, recurrent bugs. Past history easy 5T IOA. 5T, that is trauma history and previous treatment history he is going on, any traveling history, any team is involved for his treatment, any blood transfusion history. IOA, investigation, onset and admission of previously we will ask. Plus all cardiac problems. If he tell that any cardiac problem he has from birth or anything, then when it was developed, why, by whom, doctor, diagnosis, what labs, blood culture, echo finding, treatment, which team involved, like cardio and dietitian involved or not, because we know that dietitian involved, small for age, they don't develop normally. Then any operation done previously, when, why, complications. I already mentioned the dental extraction, any small wound, anything previously this happened. Admission plus details, follow-up, visits, treatment compliance, travel, COVID contact, COVID vaccine of parents. Then after past history, you go the perinatal history, pubertal history, vaccine history, allergy history, nutrition history. Nutrition history is very important here. How he is going his nutrition, any special diet he is or not, or any dietitian follow-up. Then growth charts we will ask, he is growing normally or not, weight and height we will ask. Development, family history we will ask, any family similar condition, normal we take the history, social, psychological impact of the history we will ask. Study of infective endocarditis. So when a history of infective endocarditis we find there are some differential diagnosis comes on our mind immediately. So fever in cardiac cases. What are the cases? Can be infective endocarditis, upper respiratory tract infection, pneumonia, COVID and UTI. Condition in which there is cardiac symptoms plus fever plus rash. Remember, cardiac symptoms plus fever plus rash. These three features, what is our mind? Infective endocarditis or rheumatic fever, Kawasaki disease, post-inflammatory multisystem syndrome and parvovirus infections. So this is all about infective endocarditis history. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.